The collection of blood samples will be done on nearly every patient that enters the hospital. It is a task that can be completed by a phlebotomist, an RN, or a PCT. There are a few ways that blood can be collected, but one of the most common methods is through the use of a butterfly needle. This video will explain and demonstrate the process of collecting blood samples using a butterfly needle. Before you begin, you'll need to gather some supplies from the pod room. You will need a tourniquet, a butterfly needle, a Vacutainer adapter, the Vacutainer tubes needed for the required labs, clean gloves, 2x2 gauze, tape, and a chlorhexidine applicator, or if that's not available, alcohol prep wipes. Before poking a patient, it's best to understand the supplies you'll be using. First, we'll look at the butterfly needle. At one end of the device is the needle you use to access your patient, and at the other end, connected by a length of tubing, is a gray rubber nub. That gray rubber conceals and protects a needle. Be aware of this, and be careful not to accidentally poke yourself. On the opposite end of the tubing is the butterfly needle itself. The needle is attached to a clear hub with two wings extending from either side. The gauge of the needle is printed on the top of the wings. The bottom of the wings is textured. The needle is protected by a plastic sheath, and when removed, it reveals the needle. The needle itself is hollow and beveled. Whenever accessing a patient's vein, the needle must be bevel up, which means the opening is on the top, and the point is on the bottom of the needle. This is easily achieved by looking at the wings. The textured side should always be on the bottom and the print on the top. When you access the patient, fold the wings up and pinch them together to hold and control the needle. You will be grasping the textured side. The textured plastic ensures good grip and control, and holding the device in this way ensures the needle is oriented bevel up. The butterfly needle also has a safety lock feature to protect from accidental needle sticks. If we look more closely at the hub, you'll notice that behind the needle is a small black arrow icon. This arrow is printed on top of a button that, when depressed, will activate the instant retraction of the needle, safely encasing it inside the butterfly hub and eliminating the chances of an accidental needle stick. The button is very small and easy to accidentally press, so be aware of its placement on the device. The Vacutainer adapter and tubes are used with the butterfly. To make this possible, attach the Vacutainer adapter to the end of the tubing by screwing it on. Now, Vacutainer tubes can be placed in the adapter and pushed onto the needle to activate the vacuum within to fill the tubes. All Vacutainers are negatively pressurized to fill with the desired amount of blood. This means that each tube contains a vacuum, and when a needle pierces the cap of the tube, it will pull whatever is on the other end of the butterfly into the tube. When the butterfly needle is in a vein, the thing on the other end of that needle is the blood for our sample, and it will fill the empty tube. Each Vacutainer contains a specific preservative that is designed to help identify a particular aspect of blood. Therefore, each type of lab will require a specific tube. Tube caps are color-coded to help identify the correct Vacutainer. Identify and collect the appropriate tube colors for the labs you need to draw. When drawing multiple tubes, they will need to be drawn in a particular order to prevent the mixing of certain preservatives into other tubes. The order of draw can be referenced through Policy Manager, and there are also badge cards that list the correct order. Before poking the patient, organize your lab tubes in their correct order of draw to make collection easier and to eliminate the risk of cross-contamination of preservatives. If you have this selection of tubes, you should arrange them in their proper order of draw, which would be red, yellow, green, pink, and then purple. With your supplies collected, you will need to locate an appropriate site to access. There are some things that should always be considered when locating a site. If there is an infusion running, locate a site on the opposite arm if at all possible to eliminate the risk of the infusion fluid impacting the lab results. If it is not possible to use the opposite arm, you must choose a site distal to the infusion site to minimize this risk. If the patient has had lymphedema in the past or breast surgery with lymph node removal, do not draw labs from that arm. If the patient is a dialysis patient with an AV fistula, no lab draws can be done on the arm with the fistula. If the patient is a renal patient in any respect, even if they aren't currently requiring dialysis, draw blood distal to the AC. Try to limit pokes to the hands so that the veins needed for any future dialysis access will not be damaged. With a general idea of where you want to look for a vein, place the tourniquet about 2 inches above the desired site. Tourniquets should only be on for a minute at a time at most. If you cannot locate a vein in 1 minute, remove the tourniquet and reapply in a new location to look again. Once you've located a vein, make note of the location. Then, remove the tourniquet and set up your supplies. Clean the site with the chlorhexidine applicator, scrubbing back and forth for at least 30 seconds. Chlorhexidine can disinfect 1 square inch for every milliliter in the applicator. So a 1.5 milliliter applicator, as seen here, can only clean 1.5 square inches. so only scrub over the desired access site, not the entire arm. Then allow the site to dry completely before poking. Do not blow on or wave your hand over the site to try to dry it more quickly, as this will potentially contaminate the site. Allow it to dry naturally, and once disinfected, do not touch the site again. That will contaminate your site, and you will need to clean again. Reapply the tourniquet. Grasp the butterfly by folding the wings together. You should be holding the textured side of the wings, and if you are, the needle will be in the desired bevel up orientation. With your other hand, you can anchor the vessel by pulling the skin down below the site, but be careful not to touch the area that you just disinfected. Always insert the needle pointing up the arm toward the heart. Never insert pointing down towards the hand. Angle the needle about 30 degrees to the patient's skin. Line the needle up with the vein and insert the needle until you see blood enter the tubing. This is referred to as the flash. The flash is visible in the clear hub, and when you see the flash, you know you have pierced the vessel. Decrease the angle slightly and advance the needle another millimeter or two to ensure you are completely in the vessel. And then stop. You do not need to advance the entire needle into the patient. You only need the beveled end completely in the vessel in order to draw blood. If you advance too far, you will likely poke through the opposite side of the vessel and the vein will be blown. If you try to draw blood into the tube, nothing will come, because the open end of the needle is no longer resting in the vessel. When you have appropriately accessed the vessel, secure the butterfly needle in place with one hand. You don't want it to dislodge while you are drawing your sample, or you will need to poke the patient again, so hold it steadily in place with one hand while you complete your sample collection. With your other hand, insert the first tube into the Vacutainer adapter and push it down onto the needle. If the butterfly is still in the vein, blood will immediately begin to fill the tube. You can remove the tourniquet at this time. Some sources recommend releasing the tourniquet from the patient's arm once you start collecting the sample. Others recommend removing the tourniquet after completing your collection. I have never noticed a difference in the results with either method, but removing it after you start collecting the sample will minimize the time that blood flow is occluded, and that's a bonus. But whichever method you utilize, always ensure you do remove the tourniquet before leaving the patient. It is something that unfortunately is very commonly missed, and long-term application of tourniquets can lead to negative outcomes for patients. Once you have depressed the tube onto the Vacutainer, allow the tube to fill completely. They are pressurized to pull the appropriate amount of blood, and when they are full, they'll stop filling. On most tubes, there is a marking to indicate the fill line. Pressurized tubes will stop filling when they have reached this volume, as seen here. When the tube is finished filling, remove it and insert the next tube. Still continue to stabilize the butterfly with your other hand. Removal and insertion of tubes can be done smoothly with one hand with a little bit of practice. But if you let go of that butterfly to use your other hand, the needle may become dislodged and you will need to poke the patient again to finish your collection. When all tubes have been filled, it is time to remove the needle. After removing the final tube from the adapter end of the butterfly, if you haven't already, remove the tourniquet. And then simply depress the button, which is indicated by the arrow icon on the hub. The needle will be instantly pulled back into the clear hub, eliminating any potential exposure to a dirty needle. With some folded 2x2 gauze, hold steady pressure over the puncture site to minimize any hematoma formation or bleeding. Then tape the gauze over the site to create a pressure dressing. Now return to your sample tubes. Invert each tube multiple times to fully mix the preservative with the blood sample. Do not shake the tubes, just invert them back and forth smoothly. Label the sample tubes while still in the presence of the patient. Blood samples should never leave the patient's room until they are appropriately labeled. Document the sample collection in Epic and send the samples to the lab. The collection of blood samples is a task that can be completed by a phlebotomist, RN, or PCT. When performing a blood sample collection, it is important to follow the appropriate steps to ensure the safety of the patient and the quality of the sample. Accessing a vein with any type of needle is a skill that requires practice. Don't be discouraged by failed attempts, but learn from them and hone your technique so that you can master it more quickly. It will save you time, and your patients will appreciate your dedication.